Y'all are cool. Welcome to Keeping Up with Lantz. I'm your preceptor Lantz, Surgical Tech Emeritus, and I am the Surgical TechKnowledgist. Today's episode, we're getting into breast augmentation complications. Now, I know everybody's favorite thing in the world is some titties, but for some reason, people start messing with them when they should probably just leave them alone. And then bad things can happen in every situation, but sometimes you don't get the most desirable results, and you may even have some complications with this situation. So number one on the list is going to be infection. You may have some tenderness or some redness, might see a little pus, and hopefully some antibiotics will take care of it. If not, you're going to need some more surgery. And number two is going to be a contracture. That's when the scar tissue will start to develop around the implant and make it way too firm and kind of make it misshaped and stuff like that. And that's when you get like baseball titty. Like, have you ever seen baseball titty before? Yeah, that's a problem. And sometimes you just remove the scar tissue, put the implant right back in, and it's like right where you started. Next on the list is going to be sensation or pain. All the changes in sensation, such as like tingling, or maybe like they're too tender for way too long, or it just may not be as pleasurable anymore simply because you got some implants. And oof, yeah. Next is going to be visibility and wrinkling. Sometimes you could lean forward and the tissue is just a little too thin and you can see the ripples on the side. That is not exactly the look you were going for, and that's a complication. It's not always guaranteed, but it happens more often than not. Coming in next is going to be a rupture or a deflation. So silicone can rupture, start leaking into the tissues, and of course the salines can just flat out just like deflate, leak all into the tissues, be absorbed, and you need more surgery. Next is going to be necrosis. I mentioned earlier that infection, if you don't get that shit addressed, the tissues can literally die, and you will be even more fucked up beyond what antibiotics can help you with. And yeah, you can literally have a dead titty. Another complication of this situation is going to be calcification. Oh man, this is starting to sound like bars. But you can find real hard, like rock hard deposits, like in and around the implant. That is not what you were going for. So anyway, next is going to be atrophy. You can start to lose tissue. Breast tissue can start to thin, wear away, and simply just shrink, and all you can see is the shape of this little plastic baggy thing. Another big problem can be asymmetry. If you're going in there so that you can maybe improve your look, and then next thing you know, you're looking like things are a little one-sided, like you on the fence, like you ain't sure about what's going on, you know what I'm saying? It's gonna require more surgery. So after the girls heal up and you notice one is massively different than the other or healed different, it's not exactly a mirror image, which is what you were going for. And number 10 on the list is gonna be that there's absolutely nothing wrong with them. You're just simply unhappy. You thought that maybe this would give you the body you were looking for, and that's just not the case. So there are no refunds for this situation. In fact, you will pay even more to have them removed or revised when there's just nothing wrong with them. And for hanging in this long, you guys get a bonus. So a bonus complication of this situation of breast augmentation complications is going to be changes in behavior. And now we all know confidence boost can go a little too far, and you may start doing things or behaving in a certain way that you didn't know you would do because you didn't know how to handle all this newfound attention. Speaking of which, you may incur some unwanted attention. You may find there are a few more creeps out there than you might have thought, and you're gonna have to deal with that shit, especially at work. People are gonna notice. You're gonna notice them noticing. They're gonna say something. You're gonna say something. You're just gonna have to go along with it. But I feel for the girls dealing with all of this objectification. That's not exactly what I think y'all are signing up for. Maybe you just want to feel a little better, and that unfortunately is a complication. Another bonus for y'all hanging in here today, the medication of the day is gonna be, I'm actually not gonna say the names of these, but I'm gonna tell you what it is and what it does. It is hormone therapy for children. Can you believe this shit? So this type of medication will pause your puberty. So imagine you have a 5 or 6 year old girl who started her period a little too early in life. Yeah, precocious puberty is a thing. You can use this, you can stop that and take it out. You know, it goes in the arm, it's an implant, it's a hormone therapy. You take it out when she's at the right age to have her period. But it's used for other things because it works in boys too. If you know what I'm saying, it will stop their puberty, and it is not exactly something you can ignore. So I'm gonna let you do your thing on the Google and go ahead and check out what this medication may or may not be, because I don't have the rights to call them out by name. Man, you guys are fucking awesome. Thanks for tuning in. Before we get out of here, let's do our closing count. Number 1 on the list is infection. Number 2 is gonna be the contracture. Number 3 is sensation or pain. 4 is visibility or wrinkling. Number 5 is gonna be a rupture or deflation. Number 6 is necrosis, fucking terrible. Number 7 is calcifications. Coming in number 8 is atrophy. Number 9, asymmetry. And number 10, absolutely nothing, with our bonus being changes in behavior and unwanted attention. Man, if y'all haven't already, go ahead and do that like, share, subscribe type shit that all these fucking YouTubers be talking about, because I'm trying to get paid as well. Appreciate y'all tuning in to your edutainment for today, and we'll see you on the next episode of the Surgical TechKnowledgist. Yeah.